Welcome to the deep dive. Today, we're taking a first look, sort of a beginner's guide into the core stuff you'll find in an RexBN exam prep course.
Exactly. Think of it as a quick map of the journey ahead.
Yeah, a map to highlight the key areas you'll be, digging into. It's all about practical knowledge for when you start practicing.
Definitely. This course builds that foundation. So we're just going to quickly touch on the main subjects, give you a feel for it all.
Okay, let's jump in. First up, legal and ethical considerations.
Super important.
Right. This isn't just like abstract rules, it's really your compass in nursing. We'll look at patient rights, what they actually are, how you protect them.
And informed consent is a big part of that too.
Oh, absolutely. Making sure patients truly understand their care, that they agree to it, and of course your own professional responsibilities.
Yeah, these principles really guide your day-to-day actions and your decision-making with patients. It's very practical stuff.
Okay, next. Intravenous therapy and blood transfusion.
Right. So IVs and blood products.
This gets into the nitty-gritty of safely giving fluids and blood. You'll learn, like, the critical monitoring steps.
And how to spot complications quickly. What to look for.
Exactly. Getting these therapies right is crucial. Precision matters here.
It really does. We'll cover the different solutions, blood components, things like that.
Then we have electrolytes and acid-base balance. Sounds a bit technical, maybe?
It can sound that way,
Yeah.
but it's fundamental. It's about understanding the body's internal chemistry, basically.
Yeah, how things like sodium, potassium work, and what happens when they're, out of whack.
And that acid-base balance, keeping the body's pH stable, super important for overall health.
Recognizing when that balance is off is a core nursing skill you'll develop.
Absolutely. Maintaining that equilibrium,
Okay, delegation, another key skill.
very key, especially working in teams.
Right. How do you safely assign tasks to other team members? Like, what can you delegate, what can't you?
And making those decisions wisely. It's about teamwork, ensuring the right person does the right task for the best patient outcome.
Good point. Then medication and IV administration. This is very hands-on.
Definitely. Practical skills here.
Giving meds different ways, pills, injections, IVs, always focusing on safety. Accuracy is huge.
We really hammer home the checks and balances. Preventing errors is paramount.
Can't emphasize that enough. Okay, basic life support, BLS.
Essential, non-negotiable skills.
Absolutely. The life-saving stuff for emergencies. CPR techniques, responding when someone isn't breathing or their heart stops.
It's about being ready to act, fast and effectively.
Next, there's restraints, hygiene, and safety. Kind of grouped together, but all about a safe patient environment.
Right. Keeping things clean, preventing infections.
And understanding when and how to use restraints appropriately and ethically. That's a big one.
Patient safety is always, always the focus.
Then nutrition. Seems basic, but it's vital.
It really is. Understanding what patients need, different diets, how nutrition supports healing.
Seeing that connection between food and recovery. Health and physical assessment. This is where you learn to, assess your patient.
The fundamentals. Gathering information, doing a basic physical exam.
Learning how to observe, collect data, and document it properly. It forms the basis for planning care.
Your starting point for understanding what's going on with the patient.
Pain management, so important for patient comfort and well-being.
Hugely important. Assessing pain effectively.
And knowing different ways to manage it, not just meds, but other approaches too.
Understanding pain is subjective and tailoring the approach.
Perioperative nursing care, that's the whole surgical journey, right?
Yeah, before, during, and after surgery. Pre-op prep, understanding the OR, post-op care.
Making that whole experience as smooth and safe as possible for the patient.
That's the goal.
Positioning clients. Might sound simple.
But it's really important. For comfort, preventing skin breakdown, other complications.
Yeah, knowing the different positions and why you'd use them.
Using good body mechanics, too.
Care of a client with a tube. This covers things like feeding tubes, catheters.
Right. Specific care for those devices. Maintenance, troubleshooting potential issues.
Preventing infection is key there, too.
Always.
Grief, loss, and adaptation. This touches on the more emotional side of care.
A very sensitive area.
Yeah.
Supporting patients and families through difficult times.
Developing that empathy, those communication skills.
Absolutely essential.
And then the course touches on specific groups, like pediatric nursing.
Yep. The unique needs of kids. Different approaches based on their development.
And maternity nursing.
Care for expectant mothers, newborns, a whole special area.
Right. Also, care of the older client.
Focusing on the specific health challenges and needs of the elderly population.
And finally, a quick run through of the adult body systems,
Yeah.
integumentary, GI, respiratory, cardio, renal, neuro, all of those.
Yeah, covering common conditions and nursing care related to each system.
Plus psychiatric nursing basics, mental health principles, common conditions.
Gives you that broad overview.
So, wow, that was a quick tour, but hopefully it gives you a good sense of the landscape.
Yeah, a solid overview of what the RexPN prep course covers.
Each one of these topics is a building block for your nursing practice.
Definitely encourage you to really dive into each chapter as you go through the course.
It's quite a journey of learning, but incredibly rewarding. You're building skills that will make a real difference.
Absolutely. It's an exciting path you're starting on.